the hottest weight loss drug in the country today, and it's focused in Hollywood, in LA, for the new skinny. The reason is people are losing 20, 30, 40, 50 pounds, and you don't really have to do anything. Is Hollywood now killing people in their greed to look thin? There's also this cancer risk that people talk about, and I'll sort all of that out for you.
Scroll through TikTok and you're sure to see Ozempic. Some now calling it the skinny pen, a drug developed to treat diabetes that's become known for its side effect, weight loss.
The weight just leaves. It is creating a stir though, because it's originally approved as a diabetic drug, and now people who need it for diabetes aren't getting it because the side effect of that diabetic drug is the weight loss. And is excessive weight a disease? If it is, then people need it just like diabetics.
But there's another side effect to its soaring popularity: shortages. And now diabetics are calling out people just using it to drop a few pounds.
This is where the controversy is. A lot of people have, of course, a lot of weight in this country. Diet is a problem. Obesity is classified as a medical problem now. So the people who want it for weight loss say they need it for a medical problem, and the diabetics say they want it for a medical problem. However, what's the percentage, and we'll see in a minute, of Hollywood taking the drugs away to fit into a dress? That's the controversy.
Shane Anthony was diagnosed with diabetes 4 years ago.
It really makes me mad. It infuriates me. And it's like, you people don't need it. Us, the diabetics, we need it. We need it to stay alive.
Anthony hasn't been able to get his Ozempic since October. He says even similar drugs are now sold out.
It's scary, honestly. It's scary because, you know, it could cause me to have a spike and I could have a heart attack.
Okay, so you see, it's real. There are people that aren't getting their medications. The diabetic one, Ozempic, was approved in 2017, and like all drugs, a lot of drugs, people find out what happened by mistake. You look at Viagra. Viagra was a blood pressure drug. Didn't work so well for blood pressure, but people had a side effect of treating ED, erectile dysfunction. Now it was a blockbuster drug. Just like this for diabetes, it helps. It works between insulin and glucagon, so the hormones that increase sugar or decrease sugar. So it does decrease sugar, but it's also a hormone that affects the hypothalamus in the brain and says, hey, you're not hungry. So it works in that way. Let's see if they talk about it. But it is fascinating. But that's why, and I'm going to tell you at the end, why is it that people get it for 70 and 80 bucks?
Ozempic works by mimicking a hormone which regulates insulin levels, reduces appetite, and allows patients to feel fuller longer. A higher dosage, marketed as Wegovy, has been approved to treat obesity.
Here's the problem. You see, a higher dosage means you're using more product. And definitely, the higher dosing they went in the studies, the more weight that was lost. So the people using it for weight loss are using more product than the diabetics because it's a higher dose.
But it is not recommended for people with a healthy BMI. Dr. Susan Spratt with Duke University Hospital is warning against the new trend.
Until this medication is studied in normal weight patients, which I'm not even sure it ever will be, I think the potential risks could be something that patients don't want to take on.
Side effects include nausea, but use has also been associated with a risk of pancreatitis. Spratt says they are now getting hundreds of calls from diabetic patients unable to find their medications.
Delays gastric emptying. So what happens is people get stomach upset, bloating, some people get diarrhea. That's why it's once a week, and a lot of people, it's called the weekend weight loss, because a lot of people take it on a Friday so that they can deal with the side effects for the week. Most people tolerate it well. Pancreatitis, not that common. Let's see if they talk about the thyroid cancer. If they don't, I will sort that out for you.
I know that by prescribing one of these medications, we can reduce the risk of further kidney damage and reduce the risk of future cardiac events. And now we can't get it because someone who's actually got a normal weight is using it to lose a few pounds.
Novo Nordisk, the company that makes Ozempic, blames intermittent supply disruptions of the Ozempic pen on incredible demand, coupled with overall global supply constraints.
This global supply issue, we have a problem in this country. For my clinic, I can't even get sterile water or IV saline or IV liquids for patients. Think about that. Our country has a problem getting medical supplies. It's ludicrous.
Adding, while we recognize that some healthcare providers may be prescribing Ozempic for patients whose goal is to lose weight, Novo Nordisk does not promote, suggest, or encourage off-label use.
So what happens is, because they're the same drug for diabetes and weight loss, some people are using the one that's called Ozempic, which is for diabetes, for weight loss reasons. And the one that they make with the same ingredient but higher dose is Wegovy. And so using something off-label means using a drug for a different purpose that it was FDA approved for, and that's done at the discretion of the doctor. So I can write a prescription for whatever I want if it's approved, and I can get it for a different medical problem. And that's what's happening here.
But this morning, Shane is still waiting for his prescription.
I don't think it's going to, and for a while, to either the manufacturer starts bumping up production, or they stop prescribing it to everybody that wants to lose a couple pounds.
So if people are using it for a diet to lose weight, number one, how much does it cost? And number two, is it the kind of thing where once you stop using it, you gain the weight back?
Right.
This is key, because the answer is, let's see what she says, no one knows. So no one knows how long you need to be on it. And there are case reports of people stop it, boom, they gain the weight all back. So is this something you're going to be on for life?
Right. So it has a really high ticket price. It's around the Ozempic that we were talking about, but many of these medications can cost upwards of $900 to $1,000 a month without insurance. With commercial insurance, your copay could be as little as $25.
Let's talk about compounding pharmacies. I don't know if they're going to go into it, but you can get this drug compounded. How do you know compounding pharmacies? It's where most people get their hormone replacement therapy. These are pharmacies that the FDA checks on once in a while, but they make medicines that aren't FDA approved per se. So you might hear generics made in these places. In this case, semaglutide or semaglutide will be made. Now, I asked some people, hey, is it the exact same product? And a lot of say, well, we don't know where these compounding pharmacies are actually getting it and if it's exactly the same. But the difference is $1,000 a month or $70 a month. And if you go around the internet, you'll see people, just influencers, saying, use my promo code and you get this from the compounding pharmacy. They do a Zoom type of call, make sure you're medically okay, and they give it to you. And that's why so many people are finding a shortage of this drug as well. But compounding pharmacies, keep that in mind. They're unregulated largely. Would I take this actual drug from a compounding pharmacy at this time, knowing what we know? No. Compounding pharmacies are great. I use them myself. But in this case, I would caution.
But imagine if you're paying out of pocket for this could get you to about $10,000 a year. And again, we saw the side effects, right? There is potential nausea, vomiting, seen in about a third of patients. It's pretty common. It does get better, though, the longer that you're on the medication. But there are rarer reports of pancreatitis, as well as acute kidney injury and gallbladder issues. When you stop it, so far the studies suggest, the weight's going to come back on.
Okay, let's talk about side effects for a minute. She didn't talk about thyroid cancer. That's something people talk about. In the studies, the initial approval studies, I think there was 3 million people, and somewhere around 4,000 got thyroid cancer. And then they took away people who had evidence of thyroid cancer prior. And it was around 2,500 people who should not have gotten thyroid cancer got it. Now that comes out to a low percentage. Mathematically go 0.07%. The point is here, there's about a 50% increase in thyroid cancer. Let's just, for round numbers, say 1 in 10,000. If you think, what's double that? That's 2 in 10,000. So meaning it's a very small number. So a 50% increase of a small number is still a small number. But it's thyroid cancer is something to look at. That's trending on the internet, people wondering about that. But because a 50% increase, when you hear that, That sounds really high, but it's 50% of a very small number. Still very rare to get it, but it goes to show what we don't know about the drug.
The medicine really only sticks around, the benefit, for about 3 to 4 weeks. So it's only been studied for a number of years. We don't know the lifetime issues potentially, but this is treating obesity and type 2 diabetes as a chronic illness. We don't stop high blood pressure medications. This is something that people will very likely need to take lifelong, but we don't know yet.
Oh, what's my take? Well, I personally would be very cautious about taking it from a compounding pharmacy. So that means you need $1,000 a month. A lot of health insurance companies aren't covering for people, so you're gonna have to try 1, 2, 3, 4 other drugs before they're gonna cover it. So people then turn to the compounding pharmacies. Remember fen-phen? So that caused heart valvular problems. This drug affects so many organs in the body, it concerns me. Would I take it? I would not. What say you? Are you on it? What do you think? What do you think about the controversy? Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.